My name is Qedani Mahlangu. I'm MEC for Health in Gauteng. It is not impossible to defeat HIV. We just have to work together in partnership with all stakeholders available. 30 years down the line, we have scaled up our prevention programs, and I think to some extent we've also, at a very massive scale, we've also scaled up the treatment. We've also prevented the mother-to-child transmission. We've been able to reduce that very significantly. As we speak, Gauteng is sitting at about 1.5% only of mother-to-child transmission. It's possible to be achieved in our to have AIDS-free generation in our lifetime. And I think the other important thing that we've been able to achieve, of course, as part of the prevention, was the issues of the male medical circumcision. We've seen one of the attempts around here is called CHEPS, and CHEPS is what has been approved by WHO for male medical circumcision. We've also increased since last year when we came back from the AIDS conference in Australia, the key targeting the key population. We have got a lot of peer educators who are former sex workers who are now educating their peers about the risk associated with HIV and AIDS, usage of condom, and just giving them a lot of information that empowers the women who are involved in the sex work. And of course, from time to time they get harassed by the police, but we are working with my colleague, the MEC for Safety, and that is progress. And of course, the other important thing is the work that we're doing with the LGBTI. As we speak, we've got about 4 clinics in the province. We're seeking to really get the services to be expanded across the board. We've made significant progress. However, the main challenge, which makes me really to be awake every night, is the fact that we've got 2 problems. One is older men who sleeps with the younger girls in order to give them money, whether it's airtime, whether it's to buy them Peruvian hair, and the infection rate is increasing on those girls from between the ages of 20 and 24. That is a worrying factor. On the other hand, also people who are in marriage stable relationships, the infection is on the rise simply because of the levels of dishonesty among people who are in stable relationship, because there's a false pretense that my partner does not cheat on me, and also I do not cheat on him, and again that has been proven that indeed people do have relationship and have sex without condoms, even if they're in stable relationship, because they assume the other partner is not doing it. And the truth is, you may find that both partners are doing it. So I think the Gauteng Department of Health, as things stand now, we have close to 1 million people who are on ARVs. My message to young people is that they have a long life ahead of them. They have to be careful, and one of the things that they've got to look into, really have a serious consideration, is to delay having sex. It's important really to have a self-reflection as to what are your goals in life, and all you need is the determination and a drive and a strong will to succeed, and you can conquer.